Welcome clients and guests to my YouTube channel. I'm Jason Serro and I'm a licensed professional counselor. My videos are designed to educate and empower you to make informed decisions about your mental health. If you want to watch my latest videos, subscribe and be sure to hit the notification bell so you never miss a video. If you happen to like this video or learn something, be sure to give it a thumbs up because it really helps the channel. You are about to watch part 1 of my video where I explain what generalized anxiety is and how we can properly assess our symptoms. In part 2, I explain the fight, flight, and freeze process in response to anxiety and how it may relate to your personality. Anxiety is a state of mind that revolves around worry, concern, and oftentimes fear. Anxiety can trick us into thinking we are weak or incapable of doing things. We can get overwhelmed, or what's referred to as feeling flooded. It can feel like things are going to fall apart and that we are losing control. Our thoughts can get so repetitive that they loop endlessly in our head that we waste so much time on things we can't control. This causes stress on our body. It can even result in panic and complete exhaustion. If you think it's panic you're experiencing, which is more about thinking and feeling like you're dying, check out my video on panic attacks. You'll get some grounding strategies to help you cope. Anxiety can get so intense over time that in some people it can turn into a clinical anxiety disorder where treatment is highly recommended. Other severe cases include experiencing anxiety as a direct result of something traumatic, possibly even having post-traumatic stress disorder, PTSD. Self-help, several different types of therapy, and psychotropic medication are the most common approaches to treat the condition. Anxiety can be partly genetic, so check your family tree. It can begin early in childhood or the teenage years, and it is often not recognized until many cognitive distortions have already formed and problems have arisen. In children and teens, we will see typical examples that include avoiding hanging out with other kids or big groups, calling out of school or leaving early, often due to feeling sick, poor grades or half-completed assignments, constant stress about the volume of schoolwork or it being too hard, overuse of video games, computer games, and excessive social media use, problems with overeating or undereating, trouble maintaining a healthy weight, and even unexplainable crying spells. On the severe end of the spectrum, we will see teens engaging in self-harm behaviors like cutting, using cigarettes, marijuana, alcohol, and other drugs to cover up the underlying anxiety. Any of these signs and behaviors are worth checking deeper into and exploring these observations with the child or teen. As frightening as it can be to see these behaviors, parents run the risk of alienating their child and pushing them to shut down emotionally if it is not approached with genuine care, compassion, and tact. Remember, we are trying to invite them to open up emotionally, so explain to them that you will do anything it takes to support them during these difficult times. Later in the video, I'll explain how the Diagnostic Statistical Manual, the DSM-V, defines generalized anxiety disorder so that you can get a better understanding of the condition. This information will provide relevant information so that you can communicate to a therapist or medical professional to properly assess your symptoms and develop a personalized treatment plan. For clarification purposes, in this video, we will make the distinction between anxiety and stress. We will refer to our thoughts or cognitions as anxiety and our physical symptoms as stress. For example, I may think to myself that something doesn't look the way I believe it should, and that can cause a tension headache. My anxiety is creating my stress. If it was stress first and anxiety second, I may feel my heart beating really hard and fast, and then have an immediate thought that I'm having a heart attack. There are many interpretations in my example, but I'm just trying to emphasize the distinction between anxiety and stress. Here are some examples of anxious thinking. I thought I had all the notes and materials for my schoolwork, but I know I missed something. I don't know what I'm going to do. I'm going to fail. I'm not going to even write her back because she'll think I'm stupid. I'm worried if I disappoint people, they will think less of me. I will be so uncomfortable being at that party. I'm not good at meeting new people because I don't know what to say. If I don't act like my friends, they won't like me anymore. I can't say no to people because I'll be letting them down. I have to do this perfectly or it's going to be a failure. Earlier in the video, I promised I was going to cover the DSM-V's criteria for generalized anxiety disorder, GAD. In order to be clinically diagnosed by a licensed clinician with GAD, A person must have excessive worry that occurs more days than not about a number of activities or events for a period of at least 6 months. The DSM cites work and school as common examples, but it's just as important to include relationships as well. The person finds it difficult to control the worry. What I'll see often when assessing my clients is that the worry takes on a life of its own, and thought rumination and perseveration. 3 or more of the following 6 symptoms being present for at least 6 months include: number 1, restlessness, feeling keyed up or on edge. 2, being easily fatigued, more like thinking exhaustion or mental fatigue of thinking the same loop. Number 3, difficulty concentrating or mind going blank. Number 4, irritability. 5, muscle tension. 6, difficulty falling or staying asleep. Please take notice that many of the symptoms of anxiety, as well as conditions like depression and ADHD, for example, overlap and can be comorbid, which is the presence of 2 conditions occurring at the same time. That's why it is very important to have an experienced, licensed clinician to help assess your conditions and try to separate multiple diagnoses, because it is very easy to be misdiagnosed. The effects of being misdiagnosed can be pretty severe, especially if you're not taking the correct psychotropic medication. In addition, measurable goals established by the clinician and client must be connected to the diagnosis. For example, we might say that in order to reduce your anxiety from a level 10 impact to a much more manageable level 5 impact includes practicing mindfulness strategies 2 times per day for 1 week. And we can track the anxiety by using a scale from 0 to 10, or by assigning a color to our feelings each day, where someone might indicate being anxious utilizing a color rainbow. Red might indicate a tremendous fear, representing possibly a panic attack. Yellow might indicate feeling overwhelmed, maybe like relationship or work stress. Orange can indicate an anxiety centered on financial strain or a medical issue. Green can indicate more acute anxiety, like days that feel like what can go wrong will go wrong. However, these are out of the ordinary experiences and are not chronic. Finally, we have the color blue, where you may have small amounts of anxiety or slight down feelings, maybe due to a rainy or cloudy day. Continuing down the line of the DSM-V's criteria, it then goes on to describe what the excessive worry or physical symptoms greatly impacts a person's social life, occupation, and other significant areas. Typical examples include someone not being able to perform their job 100% because their mind is occupied with those particular worries, not calling back or staying in touch with friends, becoming reclusive, or avoiding most responsibilities and activities of daily living. The disturbance or anxiety is not attributable to the physiological effects of a substance, which consists of illicit drugs, prescription medication, or any medical condition. In my practice, I'll often see the marijuana chemovar of sativa as an anxiety inducer, and some anxiety and stress symptoms resulting from detoxing or weaning off other illegal or prescribed drugs. Finally, the anxiety is not better explained by another medical disorder like obsessive-compulsive disorder, post-traumatic stress disorder, gaining weight in anorexia, physical complaints in somatic symptom disorder, perceived appearance in body dysmorphic disorder, illness anxiety disorder, or the content of delusional beliefs in schizophrenia. We assess to determine if one of the aforementioned conditions is more of a primary concern for the client and do what is called a rule out. More ways to manage anxiety better include using mindfulness practices, recording our thoughts in a journal, or even using my automatic thought tracking form. I'll attach the link below. Take a look and use the example I provided as a guide for your thoughts. Take a look at my panic attack video to get a better understanding of mindfulness and grounding techniques as I walk you through how to bring more calmness to your mind and help you better soothe your body. As I mentioned before, please set up an intake with a qualified licensed clinician who has experience working with this type of condition and get properly assessed. Or if you have a therapist or counselor at this time, I encourage you to reach out to them if you haven't already to discuss how you're feeling. Please continue to spread mental health awareness to help yourself and maybe even someone who may need a little nudge to get some help. If you liked this video or found it useful in any way, please share it to someone you believe it may help. Please subscribe if you haven't already, like the video, and don't forget to put the notification bell on so you never miss a video. As always, be where you are, be resilient.